I've got to go take another vote, so I'll turn it over to, I guess we're going to do a video of David Healy and then Dr. Doshi, and I'll try and get back as quickly as possible.
Thank you.
4 weeks ago, Frances Haugen told us that Facebook put its profits ahead of our welfare and the health of the American political system. When the internet appeared first, many of us saw something that we thought was going to help us live the lives that we wanted to live. But somehow Facebook seems to have transformed this into something that's forcing us to live the life that others want us to live. Decades before Facebook was a glimmer in its father's eyes, Pfizer and other pharmaceutical companies took an algorithm that we call randomized controlled trials, RCTs, and by sequestering clinical trial data and ghostwriting the articles about those trials, transformed it into the one algorithm to rule us all. Prior to that, RCTs had been a way to help us live the life that we wanted to live with new drugs and vaccines. After it, RCTs became a way to force us to live the life that Pfizer wanted us to live. Company RCTs separate the information we have about drugs and vaccines into sheep and goats. The sheep are the information Joe Biden wants you to know, that vaccines are harmless, a little bit of a sore arm, and they save everybody. The goats are the misinformation. And Pfizer wheeled their RCTs to brand what happens on Facebook platforms where people like Bree and Cody and others meet and try to get to grips with what has happened to them after this vaccine, and is there any way to put things right? Brand that as misinformation. Pfizer have been using their RCTs to do this for decades in respect of Zoloft and all of their other drugs, and in so doing have harmed us more and our children more than any Facebook algorithm or Instagram algorithm has done. Just like Facebook, they know what they're doing and are putting profits ahead of our safety. And in the case of the American political system, in the form of mandates, they're doing as much, if not more, harm to it than any Facebook electoral algorithm has done or might do. When it comes to free speech, most people figure it's your right to say white if I say black. In terms of doing science, it's absolutely something you should think about doing. But at the moment, the government and Pfizer are forcing us to not recognize that black is black. And when it comes to this, we're in a situation that is more than defending free speech. We have to stand up against tyranny. Facebook tell you that to engage with them, that to get the information you want, you've got to accept other information you may not want. We've no way to look beneath the Facebook bonnet and see, can we tweak the algorithm to make sure we get less misinformation and are less likely to be censored. In exactly the same way, Pfizer wants you to think that to get their treatments, you've got to accept the information that they give us. If you have to look beneath the Pfizer bonnet, it's not science, it's business. And that's the problem we have, because you cannot get to see the data. What Pfizer are offering you is not scientific information, it's promotional material. They're not in the business of looking after your safety. They're in the business of selling treatments and making money. They're not attempting to help us live the lives that we want to live. They're in the business of forcing us to live the life that Pfizer want us to live. Data is the bedrock of science. You have some data here. You've got people like Bree and Maddie who are in trials. Your job is to look at what happened to them and listen to the story and work out whether you think what they're telling you is correct, rather than the fanciful tales that you hear from Pfizer. Now, to be sure, you're going to figure when you interview them and cross-examine me that your view can only be provisional. It's not absolutely true, but that's what science is. It's provisional views that you may revise later on. It's not science if you can't see the data, and you cannot see the data from Pfizer trials, but you have the data here in the form of people who've been harmed. And if you spread the story that your impression is that the vaccines have caused this, you will get people working on the issue of, well, how does it cause this? If you don't spread that story, you've become part of the problem, and you're doing the job that Pfizer wants you to do. Pfizer don't do science. They do business. FDA know and enable this. If we accept mandates without data, we are opening the door to tyranny. Thank you.
Okay, I'm going to follow up Dr. Healy's talk and just emphasize the points about data transparency. And so in the video just now, Dr. Healy mentioned that what is under the hood of Pfizer clinical trials is not science. He said it's business. I've been reviewing industry-sponsored clinical trials for over a decade, and I tend to agree with Dr. Healy that business and marketing often seems to be in the driver's seat. In my case, it took place a decade ago in the midst of another pandemic, swine flu. And for 4 years, we fought to gain access to the clinical trial data for the drug Tamiflu. Instead of an 8-page journal article telling us about a clinical trial, we wanted the 1,000 pages of internal company study documents that we knew were under the waterline. The fact that the Tamiflu data were inaccessible came as a shock to even the editors of medical journals, who had reasonably assumed that since data is fundamental to the scientific process, surely it must be available. But it wasn't then for Tamiflu, and it isn't today for COVID vaccines. In fact, if you're interested in analyzing the data for, say, Pfizer's trial, you'll have to wait until May 2025 before you can even request it from the company. For Moderna, they recently said that the data, quote, may be available with publication of the final study results in 2022, end quote. And since the trial is not officially to end until October 2022, we're probably talking late 2022. So yes, the trial has still not ended. And yes, doctors and researchers who want to see the clinical trial data will have to wait another year from now before getting access. For J&J, try next July. If you weren't aware that the data were inaccessible, I suspect this is because so few healthcare practitioners and researchers are accustomed to conducting an independent review of the raw data. So there's little outcry when those data are inaccessible. And next slide, please. So while we're told to keep following the science, what we are following is not a scientific process based on open data. We're following a process in which the data are treated as secret. And in my view, there's something very unscientific about that. I feared we would end up in this situation because data secrecy, I'm sorry to say, is the status quo. In 2015, the Institute of Medicine published a consensus study calling for a culture change in which data sharing became the norm, not the exception. But not enough has changed. Last August, before we had results from any of the pivotal COVID vaccine trials, I co-authored a commentary with Dr. Healy, saying clinicians and professional societies need to declare up front that they will not endorse treatments or vaccines unless there is complete data transparency. The point I'm trying to make is fairly simple. The data for COVID vaccine trials isn't available, and it won't be available for years. Yet we are not just asking, but mandating millions of people take these products. Whatever word you want to use to describe this situation, without data, it's not science.